Welcome back to Real Health. If you just tuned in, we're nearing the end of the show, but don't worry, still got lots of information for you. Before the break, we talked about the importance of being proactive and preventative when it comes to our health, and that the use of antibiotics really should be the last resort. Now, in this week's Real Health Medicine Cabinet, the Real Health team came across a very effective over-the-counter homeopathic treatment for the common flu, but more on that in a bit. First, homeopathic doctor Jacquelyn Schultz is here in studio with me to shed some light on the differences between flu and the cold and how to treat it at home, and how to know when you should consult your doctor, because that's a biggie, right? We like to self-medicate, which is not a bad thing if you're informed, but when you're just doing what you think you should do and it's very ill-informed, that's when it becomes a problem.
I agree, but I mean, we know you can't jump to the doctor for every symptom.
Yes, exactly.
It's not viable from a financial perspective nor a health perspective, because you don't want to be bombarded with unnecessary medications. But you know, it's the same as when you're treating a child. You give boundaries and freedom within boundaries. It's the same with health. You know, there's certain boundaries where you have to be mindful of, okay, it's gone to a point where I need to address it, and perhaps see a practitioner. And they're very specific boundaries, even within flu, of when you need to see a practitioner.
Well, the thing is, if you look at prevention is better than cure, you know, self-medicate in the aisles where it's preventative instead of choosing things over the counter from an ill-informed perspective. What can people, before we in fact head to what they can do to prevent colds and flus, let's define what's the differences between the common cold and the flu.
Okay, well, I mean, they both are viruses, which is very important to be aware of, because a virus is only going to be taken out by your own immune system.
Yes.
A bacteria will respond to an antibiotic, but a virus won't. So both are caused by viruses. Your flu virus, the influenza virus, there are many different subtypes. They can range from mild to quite severe and deadly strains. And the thing is, they all spread via droplet infection, which means someone can cough or sneeze within a 6 feet environment. And if you are not at optimum health, and your immune system is a little bit compromised, you're going to pick up this virus. And the amazing, little bit scary fact is that you can actually transmit this virus. You are contagious for a day before you develop symptoms, and for 5 to 7 days after you develop symptoms. Now, fundamentally, the difference between the two is flu is an all-over body experience.
Okay.
Where from head
Achy
to toe,
joints,
you're going to have fever, perhaps with chills, or feel feverish, headache, sore throat, stuffy nose, maybe a bit of runny nose and sneezing, but muscle aches and joint pain and fatigue. Whereas your cold really tends to stick to your upper respiratory. Your cold tends to stick to your sinuses and your nose and your throat. It's not an all-over body experience.
Okay. Can you experience the flu without the cold, or does the cold become the flu?
Well, they're different viruses.
Yeah, okay.
So people often go, oh, I've got the flu, and they don't. They have a cold, and they have a really nasty cold, and they feel rotten, but it's not a proper flu virus.
Okay. So from the prevention side, what should people be doing? And the minute they start feeling, you know, those slight symptoms, tickly throat, or maybe a little bit of that chill, the aches and pains, what should they immediately do?
So you need to go back to the stuff that we know works, and what that means is start having early nights, start making sure that you eat properly, lots of water, fresh fruit and veggies. If you are a smoker, cut it out. Ideally, we don't ever promote smoking. Certainly reduce alcohol, refined foods, sugars. And then if you can find a product which is going to optimize your immune response to fight off the infection, that's prize one.
Okay, so you want to boost the immune system and build it up as well, but I think you mentioned something that's important, that they really underestimate. If I'm feeling fluish or a little bit of cold, you know, type symptoms, the first thing I do is I book myself off and I go and I sleep. Why is that so important? Because I find then that the next day I feel bright as rain. Yeah, exactly.
Look, we tend to, you know, our pace of life, and we're so productive, we tend to forget that you need to give your body a chance to recover. We have a really amazing immune system in our body, our white blood cells, our lymph cells, and you know, when you're born, you have an innate immune system, and every bug that you're exposed to, you build this immunological memory, and you create this acquired immune system, and it's a phenomenal system in our body. But you've also got to give it a chance to work. You know, we can't just go, presto, we better. And the way it works, and the reason you feel so poorly is it's your immune system fighting off that virus, and you need to give it the best area to do that in, and that is to take some time to rest. You may not be that hungry, but drink fluids, hydrate yourself. And that's the best thing you can do, because you're optimizing your body's ability to fight off that infection.
Okay, so before you've gone to see the practitioner, you go to the pharmacy and you choose something that's over the counter. How do you know that you're choosing something that's effective?
Well, this is where you also need to be a bit clever. We are so lucky that we have access to information with Google.
Yes.
And do your homework. Make sure you're finding a very reputable, well-respected medication that perhaps is global. And you need to make sure that that medication first is not contraindicated to any condition you already have. It's not contraindicated to a medication you're taking, that you're not allergic to any of the ingredients in there, and that also it's fine for, be it kids or pregnant women or with a condition. So that's prize one. And then of course you don't want to have a medication that's going to mask a symptom either.
Yes, and actually I was going to ask you about that. For example, the mucus. There's a reason why your nose starts running, your eyes start watering, and then immediately people want to stop that by, with just different decongestants and things like that. Talk to us about why we shouldn't be...
So, I mean, the symptoms, as you say, they're there for a reason.
Yeah.
So if you have a sinus inflammation, your sinuses are sore, they're full of mucus, that mucus is pushing on the sinuses, causing pain, and you stop the mucus coming out, all you've done there is you've said to every germ, bacteria, virus and fungi, come, live, breathe, free board and lodging, because it's stuck in there. Mucus is fantastic to provide that environment for germs to grow. Once it's flowing, we always have mucus. As I said, we've spoken before, we have a litre of mucus a day, that's normal. But you don't, when you have excess mucus secretions, that's the problem. So when you stop them, you're actually allowing infection to breed.
Yeah, I hear you. Well, now, as I've mentioned earlier, a very effective over-the-counter flu medication called Oscillococcinum made it into our Real Health Medicine cabinet. I have it with me, and for the first time I've seen this jumbo box, which actually makes sense, because I mentioned to you off air that we were traveling overseas in Europe in winter, and it was actually recommended to us. It's a homeopathic over-the-counter treatment. Tell us why it's so effective.
Well, Oscillococcinum has been available internationally for 65 years.
Wow.
And I think in South Africa for at least 30 years. It's a homeopathic medication that will optimize your immune response to fight against the symptoms of flu. And it's effective against that.
Can I actually open a box to show people? Because when you see it, it's a little bit weird, because you don't expect that. It's these little vials. Okay, it's white, but there are little balls inside right?
They're little pellets, little white pellets.
Yeah. So when you open it, you're almost like, how is this a medication?
And also tastes so nice. So how is it a medication? So every single little pellet that's in that container, and there are probably hundreds, if not thousands, in one container. Each one is individually medicated as a homeopathic remedy. And the minute you feel the symptoms of cold or flu, and I know for myself, I often make my patients laugh, because I know I'm getting flu when I feel like my glasses are too strong. I almost feel like I'm walking on a spongy ground, and I'll know the minute I feel that. I'll take one dose of the Oscillococcinum, which is, you just open that little vial, you empty the granules in your mouth, they dissolve almost immediately, and they taste nice. I don't have to worry about finding water, I don't have to worry about it contraindicating if I've taken any other medication, and it works really quickly. And because it's optimizing my immune response, even if I was wrong about it, me actually starting flu, I've done no harm. I've just primed my immune response to fight any symptoms of flu.
Okay, fantastic. And you can get it at any major health store?
Health stores, pharmacies, dispensing practitioners. And it's been around for so many years. The minute you hear someone say,
they know exactly.
You're talking about Oscillococcinum, they're like, yes, that's the one.
Well, I had to practice the name for a bit. It rolls off your mouth, off your tongue. But thank you so much for coming and chatting to us.